It's a great question. I'm happy to answer that. So PSSD, it stands for Post SSRI Sexual Dysfunction. And it's similar to SSRI sexual dysfunction, but what happens is you've taken the medication, the antidepressant, for maybe just a few doses or maybe even a few years, and the sexual dysfunction persists. Now, there's a hallmark sign. It's going to be numbing of the genitalia, and it's very much like putting lidocaine on that area. It even has a somewhat similar mechanism of action. So the genital numbing and the loss of libido and the decreased pleasure or strength of orgasm or ejaculation persists after you stop taking the medication. Now, there's not a whole lot of research out there. This wasn't even formally a diagnosis until 2006. But the most recent research is actually from Peleg et al., and it was just later or earlier this month that it was submitted. But what we know right now is there can be spontaneous return of sexual dysfunction or sexual function, but this can take years. So that's where we're at right now. Hopefully they'll keep doing research and they'll come up with a good cure soon. Now, there are a couple of other syndromes that are similar. So there's post-finasteride syndrome. Finasteride is a medication used for male pattern baldness or hidradenitis suppurativa. And then there's post-retinol sexual dysfunction, and that is an acne medication that can cause sexual dysfunction. So there's all these different things out there that can cause issues with the genitalia and issues with libido, and unless you know about these side effects or these symptoms, you're not really having true informed consent to these medications. Now, it is our responsibility as citizens to know what we're putting into our body, but it's also our responsibility as providers, even though I don't necessarily prescribe medications, but our responsibility as providers to tell our patients what they are taking and the risks involved with taking it. But if you have questions about the post-finasteride or the post-retinol, let me know in the comments and I'm happy to answer that.